So yes, so all of you can see the screen.
sir.
Okay.
Yeah.
Okay. So we were there. तो हमने ये सब कर लिया है. So हम फोर्थ स्टेज हमने पूरा कर लिया था. कहाँ पे थे हम? We were supposed to discuss the strategies. Tools भी हमने कर लिया था. नहीं, tools, we have to start with the tools, right?
Sir, we have to start from the tools.
Tools, okay. So देखिए, for making, so one of the tools like I shared with you was a log frame. Okay, so there are different ways. Like suppose I want to do a public health project on a particular area. Okay, and I want to so I've already identified the problem. So, and I also have identified the magnitude of the problem. Okay, how much it is severe in that area. And then I want to discuss about a particular topic which is of area of interest to me, and through which, so whether I am talking about the strategies, I am going to discuss the problems or the cause-effect relationship of that problem. Okay, like each and every public health problem can be divided into a problem tree. Now, what is a problem tree like? Like suppose if I make a problem tree like, just a minute, yes. So suppose if I make a tree, okay, I make a tree, and in that tree there will be roots and there will be branches. So roots will be considered as the causes for the problems, and branches will be the effect of those problems. So every problem will have a cause and effect relationship. Okay, so by using, so what is the benefit of using a problem tree model in public health? What is the importance of using a public health model in public health? Yes. Yes, anybody?
This will guide us. So how to proceed in a realistic manner to have an effective outcome.
Okay, so like I am writing on the screen. Can you all see?
Yeah.
Okay. So I am saying this is the problem. Okay. So suppose this is a public health problem, and these are all its roots. And these are the branches, what I was say, it is like the effects. It is the effects. Okay, so I would say, and these are the roots, is basically your causes. Okay, so you have got a causal effect relationship, CER, causal effect relationship, right? So you have a, so for every problem, for example, if I say, okay, why there is malaria in this area? So you might say the malaria is there in this area because the water, there's a stagnant water
yes.
over here. Okay. Now, why the water is stagnant? The water is stagnant because, number one, cause it is the municipal people are not coming every week. This could be a one problem. So when I am saying the municipal people is not coming every week, that means this is a administrative problem. Why the municipal people are not coming every week? Reason because the people who are working in the municipal corporation, they don't want to do extra overtime. Why don't they want to come overtime? Because they are not getting extra money. So you see, here the main problem is administrative failure. So in an administrative failure, at the end worker is not coming because he's not getting extra money. Okay. Second area, yes, they come, but they have to, but since the magnitude of the problem is more, the water gets stagnated because it has to be cleaned 2 times in a week. So with the person, the municipal people is coming only 1 time in a week. The other person who was coming for twice, but he was a private player, but none of them allowed because the private player was making money, but not them. You got the point? So what I mean to say is, for the same problem, there could be multifactorial. It could be multifactorial in nature. There could be 10 causes. Those 10 causes might have further 10 causes. Isn't it? And then you have to also evaluate then what are the effects of malaria, that it is causing malaria. Okay, when the malaria is being caused, what are the effects in this area? So there can be multiple effects. Effects in terms of the health of the people, effects in terms of maybe the development of that area. Okay, effects maybe in terms of socio-economic progress.
Breeding of mosquitoes.
Breeding of mosquitoes, to definitely it has got a health problem, as well as that area, there is no businesses can thrive in that area. The development is being stagnated in that area. So what I mean to say is, there could be multifactorial, and then when you create such a tree, so you make the branches cause number 1. So you make a tree, this is cause number 1. This is cause number 2. This is cause number 3. Because of third thing, the effect can be this. So you can make multiple branches like this. So the effect could be because of this. For example, somebody would say, what is the effect of demonetization of India? So the person will say, okay, the effect of demonetization in India, the crime rate has increased. So the people will say, why the crime rate has increased? So how do demonetization is related with increasing the crime rate? So the person would say, okay, because of demonetization, there was a huge population of India which was in the informal sector. And as a result of demonetization, the informal sector got affected badly, because the money that the people use was always used to transact in cash. Okay. Now, because of this, the people lost their jobs. Because of the jobs, the health of the family got affected. And then they had got no livelihood issues. When they had got no livelihood issues, so they resorted to crime. Isn't it? So one thing, so there was a chaos theory which I always quote, like a butterfly swags its a wing in New York and it causes a havoc in China. So in public health, there could be multifactorial effects of that particular, maybe a public health problem. That's why we need to make an engendered log frame. The same problem can affect the gender in terms of gender, the male in a different manner, the female in a different manner, the rich in a different manner, the poor in a different manner. Okay, that can affect one community in a different manner, the other community in another manner. So you have to talk in terms of totality. So when you talk in terms of totality, you will see that it is being done. Is it clear? So how do you know like, which problem is more important? So it is when you invite people with expertise. For example, if I have to talk on demonetization, or if I have to use the Russia-Ukraine crisis, what it is effect in terms of health, in terms of global situation, in terms of migration issues, in terms of environmental issues. So what I will do, I will invite the people from various expertise areas and we will discuss, but we will talk how it is going to affect health, how the health is being affected by policy making, how the health can be affected by the effects of the war, how the health could be effect in terms of migration problem, how the health could be effect in terms of gender violence. Maybe because people have displaced, there are a lot of girls whose parents have died, and then they are being, they are under severe threat to their own well-being. They might be molested, they might be, pushed into flesh trade. So that is again a big health problem, isn't it?
Yes, sir.
Okay, so this basically helps to initiate discussions, and then there are multifarious, because then somebody will tell you, why don't you have not thought about this problem in this manner? So this is also one of the aspects of this problem. So that's why the public health professionals has to be quite multifaceted, so that they can understand the gravity of the problem from different dimensions. They can see, that's why, those people who are quite intelligent, they try to understand the problem from different dimensions. So there is not one single answer to resolve this issue. So when the problems and the causes of these problems are multifarious, so the effects will be multifarious, and so do the solutions also have to be a multi-pronged approach. So there's not one solution. There has to be, solution has to be political, the solution has to be in terms of seen in, for example, in this Russia war, how the Europe is going to deal with it. Now Europe has said, and the US has said that we are going to put sanctions on Russia. Now India has said that we will be buying oil from Russia. So that means, even of the irrespective of the sanctions, they got a customer in terms of India that is going to buy the oil, okay, from them. But then you need to understand in terms of what is the rate of the rupee and what is the rate of the ruble. Now 1 rupee is equal to 1.38 ruble. That means the economy of Russia right now, it is even poorer than Bangladesh. Okay, now what was the currency? India's 1 rupee was equal to 1.22 paisa. And what is the currency of Russia? One rupee is equal to 1.38 paisa. Now you see how the Europe is going to, so the Europe has and the Russia has said to the other countries, like whatever is the supply that the Russia was doing into the international market in terms of oil as well as your gas, okay, so it is going to reduce the dependency on Russia for all these things. For this, how they have done the things, they said, we are going to reduce the dependence on oil by almost like 30 million barrel almost per week. So how it is done? So they said, we will bring out timing so that people should go to office only 3 times in a week. Okay, on Sundays, we will introduce a policy so that no one uses a car and uses a public transport. Then there will be restriction on using maybe, thermal or certain things and using other areas. And they also signed a treaty with Qatar so that whatever, because Russia used to supply almost 40% of the energy supplied to Germany. Now Germany has signed a pact with Qatar so that when you are putting the entire sanctions on Russia, so at the same time, all its needs can be met through Qatar. So you see, what I'm trying to tell you is, if you really want to make your decision impactful on a certain person or on a certain problem, then you have to use a multi-pronged approach so that it becomes quite lethal, and it should be able to resolve the problem in the manner you want it to get resolved. Okay, so that's why it is a very, very, in public health there are no straightforward answers to the questions. So you have to think, you have to understand, you have to understand the problem in itself, you have to understand the magnitude of the problem, you have to understand that how this problem is affecting the various genders, the society, what are the causes, what are the effects of this problem, and where the interventions has to be put, whether it is going to address the causes or it is going to address the effect, and how you are going to neutralize it. Okay, so when you organize such meetings, you should pay careful attention to the location, time, because majority of these meetings, somebody would say, are happening only, you know, in there in the boardrooms, okay, in AC rooms. So the people will say, you know, majority of these things are not going to be beneficial, because unless and until you are you know how these problems are basically affecting the stakeholders, you cannot find true answers to resolve these problems. So we should allow adequate time for discussion. So some of the tools in the meeting format could be note card exercise. Note card exercise is basically, you know, where you want to see your community in the next 5 years. Okay, so you take a card from everyone. So everybody will have his own ideas. You write all those ideas, then you make a priority list, that which is the most you know, conducive idea that you would all of you agree upon. Okay, and likewise, what is the first one, what is the second, what is the third, fourth, fifth, and likewise you name it. And usually and then you see which are the common ideas, which are the common ideas which everyone has given, and try to focus and brainstorm. So once you get this issue, so then you brainstorm. During brainstorming, what is important, you discuss the problem in multiple angles. Okay, what will be its impact, how this impact will be seen. Okay, what are the various measures that you are going to do in order to resolve this issue. Okay, what is the criteria for such a thing. So you have to capture all these ideas, and then you need to put them into various heads. Maybe there are certain political solutions, there are certain economic solutions, there are certain social solutions. Okay, and then based on this, then you make a Venn diagram. Now, what is a Venn diagram? Venn diagram, all of you know in your class 12. Okay, so what we do over here, so suppose we just a minute. Yes, so we make circle. Okay, and we will see there. So this is a political solution for resolving this problem. This is a social solution for resolving this problem. This is an economic solution. And where is the likelihood, which is the common area, which can actually affect. So now suppose this common area is going to be a part of the political solution, social and economical, and it is given almost like 50% importance. So you see, this one, you know, one objective with this one aim can basically solve almost like can reduce the magnitude of a problem. It can reduce it by 50%. Now, suppose if you are saying that you are finding almost like every month around 216, 217 odd patients every month of malaria. So by using this, you know, solution, you can reduce it to almost like around 100 patients per month, which is of great statistically significant value, because it is going to resolve your problem by almost 50%. It is your hypothesis. Okay, so Venn diagram is going to see where are the overlapping areas, and what are the three important you know, elements of those aspects, like how you are basically writing these elements and how you are addressing these issues. So this is how we make a Venn diagram. So this is again one of the tools which is being used in public health, especially when you try to make certain you know, parameters for this one, for for resolving the problems. And then there are certain, you know, field-based tools such as mapping the landscape. So in mapping the landscape, what you do, like suppose where I asked this question, like I've told you already. We ask why, where, what, how, and when. So we make a diagram of that area. We divide it into various parts. Okay, and then we'll see where is the problem most located in this entire area. So maybe this area is more problematic, this area is more problematic, this area is more. Now, what is the reason for this area to be more problematic? What are the causes over here? What are the causes over here? What are the common causes? Okay, because these are the areas where you'll see almost 90% of the people are getting affected because of this problem. So if you, rather than emphasizing on all these areas, if you emphasize on this area, this area, this area, so the gravity, the magnitude of the problem will reduce by almost 100%. Okay, so that's why you try to focus your main important aim in these areas. So this is not what is known as mapping the landscape. So it will give a people a shared bird's eye view of the landscape. It is useful for arriving at an understanding regarding the boundaries, nature, and the potential scopes for this research projects. For this to happen, you have to do various field trips. You have to understand the problems. When you actually are on the field, you meet people, you discuss with them. So that is a part of your field trip. Is it clear? Yes. Is it clear, everyone?
Sir. Yes, sir.
Okay. And then there is a citizen monitoring. In citizen monitoring, what you do, you involve the community members in assessing the environmental. Okay. So so whenever you implement certain projects, so there is a Gantt chart. So in the Gantt chart, what you make, you see this is, you make January to December. Okay, in January you are going to do this, February, March, April, May, June, and how much of the activity is being finished. So what you are trying to do, you are trying to monitor this activity. You are going to
this is
monitor.
A timeline, no?
This is a timeline, yes. So Gantt chart, Gantt. So Gantt chart is again being used, which is will give you a timeline for the project. Okay, it is an important thing for gathering the critical data, also raise the consciousness about the common problems. Okay, so this type of tools can be. So citizen monitoring is basically for the people, by the people. So what you are basically doing, you are just giving a direction, you are giving leadership. So, and you are trying to make a system so that, the information can be collected, and based on those information, you can suggest solutions which can help to address those problems. And then based on this, once you have identified the area, then you identify the key research questions. What will be the first objective? What will be the second objective? Okay, and you list a list of issues or the concern developed during the stage of building a common understanding. Okay, so from that list, the research question would be chosen, like which is your, because there are multiple problems, multiple causes, but which are those two important, So there is a 80-20 principle. There's a concept known as the 80-20 principle. Okay, that is also known as the Pareto principle. Pareto principle. What is Pareto principle? Pareto principle is 80-20 principle. Not the 80-20 which Adityanath was saying. Okay, but according to this, like the principle says, for 80% of your problems, okay, only 20% of the things are responsible. That means there will be an overlapping of the things. So when there are multiple issues, so you will always see that there are 3 or 4 critical areas which will have the maximum effect. So if you concentrate on those, means all those 3 or 4 issues, your 80% of the thing will be resolved. Okay, so for example, one of the formula, like how the student is going to get a job. So if the student knows how to speak, communicate properly, he can speak the English and the regional language. He has a command over how to write emails, how to draft. Okay, at the same time, if the student has got a necessary skill set which is being which the NGO is looking at, or which the person should know, definitely he will get a job. So the job will depend on these two factors are the most important thing to fetch a job. Then comes the other part, the networking and the other things, blah, 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 blah. So this is what is known as the Pareto Principle, which is basically an 80-20 principle. That means for 80% of the magnitude of the problem or the severity of the problem, 20% things are responsible. So if you take care of those 20, so even in a business, now for example, is having multiple business, but if you have got 2 or 3 main businesses, your majority of the profit will come from those 2 or 3 businesses. The rest of the other things will fetch you a little bit. Is it clear? Is Pareto Principle clear to everyone?
Among
Yes,
the different types of the methods which I'm going to apply for solution of the problems, then there will be a list of solutions. But
there will be a list of solutions.
Yes, then we have to prioritize which will be taken so that the maximum job is done.
Yes, yes, yes. Very true. Very true. So we have to prioritize, like, so we have to prioritize those solutions which will bring about maximum benefits. This is what I said. Okay. So you have to prioritize, because this, if you concentrate on these two, it is applied everywhere, even in the elections. Like if you concentrate on these two factors, you will definitely win the match. You will definitely win the elections. If you will definitely, do such a, so that is an hypothesis. So 80% of the results you can get by concentrating on 20% of the things which are the most important. Okay. So these are the things, and then once you have identified, you choose the criteria for identifying the research question, and then you rank them in potential order, in a descending order or an ascending order, depending on the priority. And then you use different type of methods for tools. Like one method for ranking could be use of matrix. You can write different alternatives for solving 1, 2, 3, 4. Then you can see which are the more common areas, and then you want to see how many votes are there for the first option. Okay, so like this you create the various matrix in terms of feasibility. So like I told you, even for the solutions we make a SMART criteria for all the indicators. So there is a SMART criteria. What is SMART criteria? So the solution what you are suggesting should be specific. Okay, it should be measurable, it should be accurate, it should be realistic, and it should be time bound. Then only a solution is good solution, or even an indicator has to be a good indicator or a SMART indicator. So a solution or an indicator has to be specific, it has to be measurable, it has to be accurate, it has to be realistic, and it has to be time bound. Okay. So depending on this, you make a matrix like this. So in this matrix, there are various. So, one is the low possibility and one is the high possibility. Low, medium, high. For example, if I say, if I want to start some new program, suppose my aim is to develop a new program. So I would say, I want to start postgraduate diploma in public health. I want to start postgraduate diploma in hospital administration. I want to start a new program in health insurance. So then I would say, okay, what has to be in a scenario where I've got high number of students? What has to be a scenario when I got low number of students? And what has to be the scenario when I choose a medium number of students? So depending on this, how much revenue I'm going to get, that will all cause like what type of an input I'm going to make. Suppose my input is more, but my output is less. What will happen? The model will collapse. Suppose the input is less and the output is very high. That means the model will be sustainable, and you can replicate this model at a number of places. And when it is 50-50, that means there is definitely a chance, but only if if you understand the situation and you target the right audience, then only you can cleanse the gold in such a scenario. Is it clear? So this is what do you mean by high, medium, and low. Is it clear, everyone? Yes, what happened? You're all feeling sleepy?
No, sir. No, sir.
No, it's good.
No,
Very
sir.
interesting.
Actually,
Very
today very
interesting.
much network problem.
Acha. Okay. So my voice is audible, na?
Sir. Yes, sir.
Very audible.
Yes, sir.
Okay. And then we have got various strategies for the other elements of PR. What is PR? What do you mean by PR?
Participatory research.
Participatory research. Excellent. So in participatory research, we all know like it is not a one person's domain, but you have to be full participation from the different domain areas. So what is important over here is, in participatory research, we need to use different research methods, the collection of data, and then you have to see whether, because there's a heterogeneous, there are various heterogeneous groups where for a homogeneous problem. Okay, so you have to see, like, it is not a research method, but it is an approach that presents people as researchers. And the difference in applying the methods of conventional research as PR is that emphasis on people working together using tools such as described above to achieve the common understanding. So when different peoples work together, they will understand the problem much better. They will discuss about the problem. They will try to understand their solutions, and then try to make custom-made solutions depending on the gravity or the magnitude of the problem, because the same solution will not work for every. And the same problem, same solution may not be working in different districts of that state, or even different states as for a matter of fact, and even for that country itself. Okay, so these things becomes a very important when you try to look in totality. Okay, when you try to look about the solutions from different angles, and what are the various initiatives that you can do. Okay, how you are going to monitor those initiatives, how you are going to make the system and processes, how you are going to classify the various indicators, how you will know like you are on the right path, you are not not going away from your target. Okay, how you are going to convince the people, how you will convince the community to affirm with your decision making, and to be confident that it will not, the decision won't backfire. So you see, there is a whole gamut of activities that has to be done to make these work. So what are the various steps in the research studies done in the public health domain? So to summarize, we formulate a research topic or a question, we do a review of literature, we draw a protocol, we formulate the actual objective, we try to define the study and the population. Okay, and you try to use different types of sampling techniques. We have to define the variables, we have to type different type of scales, we have to construct a questionnaire. Okay, and we want to use different methods of data collection. Okay, and the different methods of data processing. Okay, depending on the different types of variable, whether you have got nominal variable, you have got ordinal variable, interval, or ratio data. And then you have to do an analysis, interpretation, and report writing. Okay. So this is what I've already suggested you, I've already told you. So these are the different, so formulation of research. Is there any problem in this? How do you formulate a research topic or a question in an area? Depending on the magnitude of the problem, depending on the how much it is affecting the population on the ground. What are the key factors which make it a problem, and whether the key factors play a significant role or an insignificant role? What is the magnitude of the problem in the society? Okay, so what is the significance and relevance? So significance and relevance are very important. What is about their quotient about researchability? Whether if I see my teacher always used to say one don't do any research just for the sake of doing it, because if you already know this is the answer, then why, for what purpose you are doing the research? So research should always be done if you have an inquisitive nature, if you want to intrigue you about certain things, you have a curiosity for knowledge, you want to know, you want to challenge the status quo, you want to know a new thing. So then the research would be, and then feasibility of the studies are very important, because in terms of significance, relevance, researchability of the topic, the question about ethical and the moral issues, okay, about the feasibility of the study, personal curiosity. So these are very important components for initiating any type of research. Then comes the review of literature. In review of literature, when you do a systematic review or you do a meta-analysis, what is the difference between a systematic review and a meta-analysis? What is the difference between a systematic review, and a meta-analysis?
Systematic review, it's done for the years. Meta-analysis is it's an analysis can be done with already their articles which have been already there.
So systematic review cannot be done with the articles?
No, sir.
How come? How a systematic review is? Why it is named a systematic review then? Isn't it? There must be certain criteria why it is called as a systematic review, right?
Yes, sir. As it, like, what I know is it has to be done. It's a long process. For example, if it is a diabetes, in case of diabetes, if the patient, if a patient is a given patient has given a drug for a long term, so diabetes is a long term. So we have to do the follow up. So such type of studies are systematic studies.
No, not systematic. I'm talking about systematic review. We are discussing review of literature, na? So I'm asking, what is the difference between a systematic review and a meta-analysis? Have you heard this term before, meta-analysis?
Yes, sir.
What is a meta-analysis? Yes.
Collecting of different articles and doing a study.
Okay, but don't you think in systematic...
Meta-analysis is a type of research where we can go through the research done previously.
Okay.
By other research worker, in terms of it may be I mean some formal epidemiological study done in the past.
Okay.
And we have to know what we want to know, what was the result of the authors who did this research previously.
Okay. Okay. Yes, Ujjwal.
Sir, meta-analysis is a quantitative, formal epidemiological study.
So
sir,
you have named three things.
Research,
so you have named it is a quantitative in nature.
Epidemiological, yes, sir. Epidemiological study design used to systematically assess the result of previous research to predict conclusion about that body of research.
Okay. Okay. So it is systematic, it is quantitative. So my question again comes as, what is the difference between a systematic review and a meta-analysis? What you know in theory. Yes, Google, somebody of you Google it and try to see online. Yes.
Systematic reviews are clearly formulated question that use systematic.
Okay. And then what is the meta-analysis? Yes, because review of literature is very, very important. And unless and until you know like what has been already written about this particular topic, okay, what all dimensions have been studied earlier, then what is the new thing that you are going to tell? And if you are, repeating the same thing that has already been said, then what is the use, like in terms of, for new knowledge, new understanding, what new have you done, isn't it?
Okay, sir.
So systematic analysis is basically collecting of those articles and everything, okay, in order to see like what are the strong points, what are the weaknesses, and to find a series, from where it has started and till where it has reached. So that is a systematic. But when you talk in terms of meta-analysis, in a meta-analysis, you have to make a Prisma table. Now, what is a Prisma table? Prisma. Have you heard this name before? Yes, have you heard this name before? Prisma table.
Yes, heard, but cannot recollect. I heard it.
Okay. So Prisma table is PR just a minute. SMA. This is Prisma. PRISMA. So Prisma table is basically how many articles you have seen in regarding this issue. Okay, what was the inclusion criteria? What was the exclusion criteria?
I think it is a tool. No? It is one of the tools. No?
It is one of the tool again for doing a systematic review, and then based on the Prisma table, you make a forest graph. Forest graph, FOREST-GRAPH. So forest graph again is a quantitative tool which is going to tell you like what all the causes that has been, or what all the effects, what this problem was mentioning, what is the common point in terms of all these studies, which factors that you should be able to emphasize more and which factors you should not emphasize at all. Okay, so they made a statistical tool, and this tool basically will help you to explore this problem, just to explore any public health problem more intensely, more in depth, okay, in order to find tangible solutions regarding the same. Okay, so that is basically the use of meta. So systematic review and meta-analysis is written together. That's why people will tell you write about the topic, and then followed by that you are doing a systematic review and a meta-analysis. Is it clear?
Yes, sir.
यहाँ पे एक क्वेश्चन है सर, प्रिज्मा टेबल ये सेकेंडरी डेटा में इन्वॉल्व है?
हाँ, तो प्रिज्मा टेबल ऑलरेडी जो आर्टिकल्स पब्लिश हो गए हैं उन्हीं में से ही ना तुम एक सोल्यूशन निकाल रहे हो, बता रहे हो। तो उसमें क्या है कि ऑलरेडी जो आर्टिकल्स पब्लिश हो गए हैं उनमें से आपने कितने आर्टिकल्स को पहले कंसिडर किया, किस बेसिस पे आपने कंसिडर किया, तो उसके लिए पूरा आपको खांचा बनाना जरूरी है। क्या क्राइटेरिया क्या था?
सेकेंडरी डेटा का टूल्स है,
ये सेकेंडरी डेटा का टूल है। हम तो डिस्कस वही कर रहे हैं ना, अभी तो सेकेंडरी डेटा ही डिस्कस कर रहे हैं ना, अलग अलग से। तो रिव्यू ऑफ लिटरेचर तो नेचुरली आपका कोई ऑलरेडी छपा होगा, उसी को ही तो लेके चलोगे। जो आपने किया है वो तो प्राइमरी हो गया ना, क्योंकि आप उसको क्वेश्चनर से उठा रहे हो, आप उसको अलग मेथड से डायरेक्टली असेस करके उठा रहे हो। दैट इज
Yes, the paper which you have given us for presentations, that is a literature review, and there some 275 or something like that. The total articles were collected, out of which some were discarded because of the definition criteria.
Exactly.
Like that.
Exactly.
Yes. Then you come to the last. I think it amounts to about 54 or 55 articles based on which you analyze the data which you
Yes.
are doing. And come
So
to
that means the reader, whosoever is reading now from a crux, they need not to go through all those 200 articles now, because some researcher has listed them. They have to highlighted the important points, and they have out of these. So suppose there are 15, 20, 30 important points that you have already raised. Out of these 30, 50 points, 15 points, you will see again follow the 80-20 principle, like which points will create the maximum impact. Okay. So like take this issue of hijab. Okay, now it is a question, according to me and according to what I say, now it is a question of dressing. Now if I see this as a problem, like a girl, okay, there are Muslim girls who might wear a hijab. There are other girls which may not like to wear a hijab. It's your personal dressing, is your own personal thing. Now if covering a head and not covering a head, okay, but it impacted in such a manner that 4,172 girls has to leave education, and maybe their 1 year is going to be utterly wasted. Because the parties, they know there's an attitude where there's an inclination, and as a result of which it has a potential cause to bring about various enmity between the communities. And because religion and everything is a very sensitive topic, now if you try to bring about certain diktat, then definitely the problem could be seen in terms of social as well as economic impact. Okay, now maybe there are girls from where the house was quite nearby. Okay, and that's why, so if the parents tell you cannot go against, and you have to remove the headscarf, then it was not acceptable. Now, but what was the overall impact? The overall impact that maybe one of their year will be lost. So now some sensible person will tell about the question, like why this issue was raised right now, why it was not raised maybe after the board exam or before the elections. Because maybe there was a scenario, because they thought that it has got all the ingredients to make it is a question of unrest in the society, and maybe the target can be achieved. Okay, so if we see this thing as a common problem, what is the end result? Maybe the education will be affected. Okay, so in terms of when you do a review of literature, you basically look at how do you formulate and redefine the statement of a research problem to minimize the possibility of duplication of research, so that what is the new aspect that you are trying to look at, to suggest a conceptual framework for the study, to learn about the feasibility and critically evaluate the various methods which are being used by the other researchers, to choose the most appropriate design for your investigation, to help to fine tune the research methodology. And it also gives, from a reader's perspective, all the hard work, because you basically summarize everything and put it into a form of a statement. So the investigator should become acquainted with the important and relevant literature, and should know how to make effective use of. So a person should know from where to collect, which are the various websites, from where you will get a systematic review, what is Medline, what is Sinahel. Okay, one day I will also take a class on the various websites, okay, from where you can get various literature, how to do a review of literature. Okay, what are the various websites that you can go, how to collect information from there. And then you also draw up protocols. The value of any investigation depends on the sound protocol. So how do you make the system and the process, what type of protocol that you follow, what type of a hypothesis that you make. Okay, what do you mean by a null hypothesis? Okay, hypothesis means assumption. So I will say okay, the problem might affect girls more as compared to boys. Okay, so if this is my hypothesis and I am making a one-tailed hypothesis, yes, I am assuming that girls will be affected more. So this is a one-tailed hypothesis. Now, if I say no, this problem can affect the boys, and maybe or may not be. And if it affects, whether it will affect boys more or girls more, we don't know. So that is a two-tailed hypothesis, because we don't know whether it is going to affect the male or female, and if it is male, between it will affect both male and female, then who is going to be affected more, either male or a female. Okay, so likewise, we have to make various hypotheses. The null hypothesis has to be tested. It has to be framed. The population has to be identified. Okay, the variables has to be identified. It has to be selected. What types of measurement and how the sampling has to be done. What is the sample size that you have to take? Okay, how you have to allocate, which type of method you should allocate for sample size collection. Okay, and then how do you try to get the data? What is the methodology? Whether you have to go in, you need to take it online, or you have to go, you have to send a questionnaire to somebody, or you will go to the ground in order to take individual responses. Okay, and then how do you how much is the gravity or the magnitude of the problem of non-response. Okay, again, because if the non-response number is high, then definitely you cannot say something conclusively. Then what is the process and analysis of collected data? How much time it is going to require? You really need also to see the feasibility of the study, and what are the experiences from the earlier studies. Yes, is it clear? Are these points clear to everyone? Any doubt? Yes. Any doubts with anybody?
Hypotheses or objectives, both are same?
No, hypothesis is an assumption. Okay, from the assumption, you have to find out objectives. So for a hypothesis, there can be 4 or 5 objectives. For example, in the PhD thesis, in a master's thesis, we make a hypothesis and there will be only 1 or 2 objectives, one major objective or one minor objective. But in a PhD thesis, you see a problem and you have to make a hypothesis, and there has to be 4 to 5 objectives. That's why it takes almost like 4 years of time. This is the difference between a master's and a PhD. So in a hypothesis, hypothesis is more like a statement. Okay, it may or it may not, this or that. But when you certain objectives, then you will say this thing may be working because. So I would say this is the hypothesis, and these are the broad objectives. To find out the gravity of the problem, to find out the magnitude of problem, to find out the responses of the public with regard to this problem in the society. So see, the first one is an objective, different objective, because there I'm trying to find the magnitude of the problem. The second one, I'm trying to see the response of the people to that particular problem. And the third will be the economic impact. So for the same problem, you can have 3 different types of objectives depending upon how you have thought the problem and what type of a solution you are trying to recommend in order to resolve that issue. Is it clear? Is it clear to everyone? Any doubts?
Hypothesis will take up this will be in statistics class, no?
Yeah, we will be dealing with hypothesis separately. Okay. So here the study objectives are different and the hypothesis is different. Particularly in public health projects, hypothesis is different than public. For a general saying, we might say, oh, okay, hypothesis, but hypothesis is more like a statement. Okay, and from the hypothesis, we make various clear-cut objectives. Okay.
Okay, sir. सर एक्चुअली हाइपोथेसिस ये हो सकते भी, ये नहीं हो सकते भी.
हाँ, तो वही कहा ना कि हाइपोथेसिस हो भी सकता है, नहीं भी हो सकता. वही तो, अगर नल हाइपोथेसिस होगा तो इट मींस ए इज इक्वल टू बी. Alternative hypothesis होगा तो A is not equal to B. That means A is greater than B or B is greater than A.
Yes, yes.
ठीक है. And then उन hypothesis को measure करने के लिए, उन objectives को measure करने के लिए you require various. So see, again, objectives can be smart. It has to be very specific objective that I told you. It has to be measurable. It has to be attainable. It has to be relevant. It has to be time bound, time frame. Okay, so this is a smart objective, smart indicator, smart criteria. So for doing any study, research study in public health, you have to define the study. You have to identify the control population, like what is the study population. The population should be clearly and explicitly defined in terms of place, time, and any other relevant criteria. Then you have to define whether sampling would be really be helpful or not. If sampling would be helpful, what type of a sampling would be helpful? How will the selection from the study population will be done? How big should be the sample size? How many control groups will be required in order to see the effects? Okay. So the cases should be a represent. So the population that you, so the study sample, what you are drawing should be the population, from the population should be a true measure of that population. Okay. So that has to be a homogeneous group. Okay. So, so you have to see, and then based on this, you have to use various controls. So controls that you might take, maybe you can take from the various hospitals, from relatives, neighbors, and from other general population to see whether there's a difference between the two or not. Okay, so we need to use various type of controls. So this is a broad overview. So these in public health, it can be the controls could be the hospitals, could be the relatives, that is relatives, spouses, siblings, okay. They can be taken from the neighborhood. They can be taken from the control population, from the general population. And then one thing could be matched. Okay, in terms of they could be matched among, which is almost very near to the same as the old one. So you have to match. So matching has to be done in terms of inclusion criteria, exclusion criteria. Okay, so there has to be internal. Suppose you are doing some cohort study. In a cohort study, you will take a cohort. Okay, like a cohort of age. For example, those people who are born in 1979, what is the common feature in all of them? Okay, cohort in terms of multiple sclerosis, cohort in terms of any disease. Okay, so that you can take a various cohort for it. You can do an internal comparison. And you can also do, so external comparison, the other name for external comparison is benchmarking. Okay, and write it down, benchmarking. So whenever you are, so internal comparison I can do, but external comparison I might use the best standard. For example, if I'm taking, I want to reduce the maternal mortality rate. Okay, and I'm saying, you know, the for the benchmarking, I'm comparing Uttar Pradesh cannot be compared with Manipur. Uttar Pradesh in terms of has to be compared with Bihar, or not even Bihar, but with Madhya Pradesh. So these are two bigger states, and then the benchmarking has to be done from the bigger state, so that you can understand what is the gravity of the problem, how much difference it is there from the main issue. Okay, and if the other organization is able to achieve, why this organization is unable to achieve. So internal benchmarking or internal comparison and external comparison is very much important. Okay, because this benchmarking in terms of both inner and outer external benchmarking is going to give you the real picture or the real scenario, okay, about that particular aspect. Is it clear? Benchmarking.
Yes, sir. Yes, sir.
And then we will be comparing with just general population rates. Okay, how we need to see how it is different in terms of general population, and in terms of experimental designs, we need to see the various controls that we need to have. Okay, what is the type of a design we are going to use, what type of an intervention, what type of placebo we are going to use. So these are the important aspects in terms of the experimental. So in the next class we have already discussed research designs, but then we will discuss in more details. Okay, different types of, and we will have
Sir,
a clear cut
यहाँ पे
understanding.
एक क्वेश्चन है सर, ये जो कोड स्टडी, इंटरनल कंपैरिजन, एक्सटर्नल कंपैरिजन, ये ओनली पॉपुलेशन का जो यहाँ पे नहीं, ऑल रिसर्च मेथोडोलॉजी के लिए अप्लाई है?
कौन सा
सर
इंटरनल कंपैरिजन? ये पब्लिक हेल्थ, पर्टिकुलरली पब्लिक हेल्थ रिसर्च प्रोजेक्ट्स में ना, जैसे हॉस्पिटल्स में मान लीजिए मैं हॉस्पिटल्स का मैं निकालना चाहता हूँ कि इन्फेक्शन रेट हॉस्पिटल्स का हम कैसे कम कर सकते हैं, तो आई विल डू एन इंटरनल कंपैरिजन विद इन माय सिटी. Okay, then an external comparison I can do a comparison with the state capital. तो मेरे सिटी में मान लीजिए कि इन्फेक्शन कंट्रोल सबका ही जो है किसी का 30, 32, बट जब मैं इसको स्टैंडर्ड बेंचमार्क से करता हूँ हॉस्पिटल में, सो सपोज मेरे पास में वहां पे निकल के आता है इट इज अराउंड very less. So I would say when it is being replicated in the other places, why it cannot be done over here? आप मतलब बेंचमार्किंग इज आल्सो नोन एज कि आप स्टैंडर्ड से कंपेयर करते हो ना. जैसे गोल्ड है, गोल्ड 24 कैरेट खालिस सोना है ना, तो अब कोई भी चीज 22 हो 21 हो तो वो 24 तो नहीं है ना बस.
यस सर.
इसलिए उसके प्राइसेस भी कम होंगे. तो गोल्ड स्टैंडर्ड, इसलिए उसका नाम रखा हुआ है गोल्ड स्टैंडर्ड. ठीक है ना, तो उसके लिए इसको बेंचमार्किंग किया जाता है. इज इट क्लियर?
यस सर. यस.
सो कोई भी अच्छा रिसर्च डिजाइन जब आप बनाते हैं तो इसमें कंपैरिजन, यू हैव टू डू अ कंपैरिजन बिटवीन डिफरेंट वेरिएबल्स, और यू कैन हैव अ कॉज इफेक्ट रिलेशनशिप. Okay, so it can be quantified in terms of absolute numbers or in relative terms. You have to allow for the contrast, okay, for to be quantified. So jitna quantification hoga, that will be better. You have to permit the investigator to determine whether the risk factor and the disease occurred in order to determine the temporal sequences, so that there is some sort of an interaction which has caused the various disease. Okay, in this case. And then you have to minimize the biases. Okay, you should not be partial. You have to see how the results have been interpreted and what is being basically the overall crux or the summary of the study that you have already seen. Okay, so in the next class we will start with the research design.
Okay.
Okay.
सर
yes.
आपने मेरे पेपर देखा
है? कौन सा? ये अभी आपका तुम्हारा ये जो तुमने भेजा है?
यस सर.
ये अभी देखा नहीं पूरा, मैंने ऊपर सुपरफिशियली देखा था, तो मैंने अभी डेप्थ में नहीं गया. ओके, सो आई विल गो थ्रू इट. यस
सर. ये वो पेपर सर नेक्स्ट क्लास में डिस्क्रिप्शन होगा ना?
हाँ, वो नेक्स्ट क्लास में भाई. तो आज तो तुमने पूरा उसको पहले पीपीटी के फॉर्म में बना लो. ओके, जो कि आप इजीली वो कर सको, एंड देन यू प्रेजेंट योर टॉपिक. ओके.
ओके सर.
यस. एनीथिंग एल्स? So can we leave? Then we can stop the class.
Yes sir. Thank you sir.
Okay.
Thank you so much.
Okay. Okay. Thank you, everyone. Good night.